let's have you go ahead and this one you can do in a sitting position on the end here. Now, this is a foraminal compression test, okay? So again, when someone comes in, you're like, I have cervical neck pain and sometimes it's radiating down my arm, okay? What you're worried about there is some type of foraminal compression with a nerve root or maybe a cervical disc being herniated, right? So now this test, I'm going to caution you, you've got to be careful with this test because you're going to axial load them on their neck, right? So if you get an elderly person or somebody with osteoporosis and, you know, or prior neck surgeries, then I'll show you an alternative in clinical to this. Obviously for the test, you're going to do this particular test, okay? So what you do is, if she was coming in with neck pain and you want to go to the side that it's radiating at. So if she said it's radiating to the left, then what you do is you have the patient go ahead and turn your head this direction, since it's the left, and then watch me, tilt your head back. Perfect. So keep her in that position, and then you ask before you press, are you feeling anything now? Any pain or radiation? Because if you do, and it's going down the arm, just stop. You know, you pretty much, you have a positive test at that point. But here, you're going to axial load. Make sure when you do this, look at the spine as the place you're going to load. Don't come over to the forehead and her head's bent off and press. Press directly over the spine, okay? When you do this, do not jerk. Do not go like this, right? You just slowly weigh that down, okay? Do you feel any pain with this? Any radiation? Feel plenty of pressure?
Yeah.
Okay. So again, don't get overly aggressive with that. Now, the alternative, again, this is alternative for clinical. For testing, that's the test, okay? But for clinical, I actually learned for foraminal compression in someone you are concerned, like these elderly patients or osteoporosis, if you actually just keep them midline and then take an ear and touch it to the shoulder, perfect. You can do that as a start, and if they get symptoms down their arm, that is positive foraminal compression. And then the other way you can do it is actually tilt your head over. Okay, so what you'd want to do is, let's say it was going on the left, you have them tilt, and then touch their ear to the shoulder. That's an alternative way. And if they get a shock symptom down their arm, that's also positive foraminal compression test. Okay? But for the test, Furlings is what we're going to be watching you for. Okay? So those are all the specialties. What's good about this is none of the specialties really take that long. You know,